All right. Okay. Well, thanks everyone for joining. This is brain injury basics. I taught this class it's been over a year. But we had a baby and my initial purpose with this class was to do a six-part series. Just based on what you'll see today, it'll make more sense why it's six parts. So I wanted to revamp it. Partly because, I still think this information is really important. Even in the past year, some technology has changed. Some of the methods that the clinics that I'm associated with have changed as well. So I think it's important for people to know about this. And then also just I like to I like to talk about the way that I approach brain injury rehabilitation. I think it's different. I think it offers some new avenues for people who are looking and searching for continued healing. So I do think this information is really important, and I'm trying to give it to you in a very digestible way. Because when I first learned about neurology, my background is I'm a chiropractor, but I have a 300-hour certification course in neurorehabilitation. I'm also a family nurse practitioner. I really enjoy working with all types of patients, but the brain and brain rehab is probably the most fun to me, maybe because it's the most challenging. So, I just, I think that concussion care, stroke rehabilitation care, brain injury care is still evolving and it needs to continue to evolve with new technology that's coming out. So, yeah, that's why I'm teaching this. I'll stop blabbering. So, brain injury basics. One more time, you can see, just making sure you can see my screen. Um, okay, here we go. So once you've seen one brain injury, you've seen one brain injury. That's the way I approach every patient. You know, I've just never seen a concussion, a stroke, a brain injury exactly the same. We're all made up of some of the same nervous system materials. But I think as we go through life, we have totally different bodies. Our software is different, if you will. So when the brain gets injured, there could be just totally different physical abnormalities or cognitive abnormalities that happen. Wait, you couldn't see the PowerPoint? Oh. Um, So the reason I say this is because I just don't, there's a lot of generalized things that can help someone who's had a concussion, a brain injury, or a stroke. Standard therapy can help tremendously, but sometimes brain rehabilitation, a patient will plateau. And that's when I think it's important to start reaching outside and thinking outside the box and doing new things to help the brain heal. So this is what I really wanted to talk about today, and what I really wanted to just get to you guys so that you can kind of understand the way that we do our therapy in the clinic, why we do it the way we do it, and why our approach is a little bit different, and why I think it can help, anyone who's had a brain injury. And there's a lot of stuff you can do at home to help with this with your symptoms. So I think of the brain and the nervous system as a home. And just like a home, the brain is built from the bottom up. And while the brain's also built from the back to the front, which means the sensory to the motor area. But the brain is built from the bottom up. Our nervous system starts to build up from the brainstem. And that's really important because a lot of standard medical treatment, rehabilitation treatment, it's not really focused on rebuilding. It's more focused on, fix the deficit. And that's just from what I've seen. So if you can think of your nervous system as a home, you can kind of change the way you approach your own rehab. And you can also have these conversations with your providers because it really makes a lot of sense. So, in a brain injury, you get there's all different types of brain injuries, but what really happens is there. if it's not a concussion, even in a concussion, this can happen too, but there's really significant changes to the nerves. And I'm sure people have seen this before, but you can get tensional or stretching changes to the actual axons of the nerves. You can have rotational or twisting changes or shearing changes to the nerves. A lot of times, this is stuff that will not show up on a standard MRI. Sometimes it'll get by even fancier brain imaging, like diffusion tensor imaging, a newer type of brain MRI that they're doing. So just knowing that this happens, and this happens not just in the brain, but with the brain, the way that it sits on top of our brainstem, if there's any sort of movement, like forward, back, side to side, or twisting, you have to also think about what's happening to the cells and to these axons that are transmitting information to and from brainstem to brain. And a lot of times what happens is there's twisting, shearing, stretching of those axons and those nerve cells as well. So a brain injury isn't just the brain, it can also change the brainstem. And not to go down a rabbit hole, but when that happens, your brainstem is your bridge to your spinal cord and to the rest of your body. Inside your brainstem live very important cranial nerves. So that can totally alter communication between your brain, your gut, your brain, your heart, and vice versa, and every other organ in the body. So a brain injury is a whole body injury, and it does require a whole body approach, not just brain rehabilitation. So I think of a brain injury, a stroke, a concussion. I think of it as like a tornado or really, really dark skies that are coming in, high winds, and it just totally messes up the house. So imagine this is a healthy brain on the left, and this is a brain injury on the right. And the reason I like to think about this is because that helps me when I'm trying to rebuild the brain. So when I think about the brain as being a home, I think about the most important things of the home and going up from there. This is a common saying. This is from the American Stroke Association. These images here, neurons that fire together, wire together. I'm sure you've heard this before. So the brain can change. That's the reason I'm showing you this slide. And it blows my mind that to this day, there are still patients that we see in our office that are told this is the way that, oh, let me just mute you. This is the way that you're going to be. This is, there's not going to be any progress, yada, yada, yada. And in my mind, I'm like, how are medical providers still telling patients that? That makes no sense at all. Um, yeah, if you can just mute, I can't find the thing to mute it. So neurons that fire together wire together. And if there's an injury in the brain pathways can be rerouted. We know that for sure. It can totally happen. We've seen it in our clinic. So the reason I'm telling you this is just do not ever accept what you're told or what a loved one's been told at the time of injury because the brain can change. Now, with that being said, there are two, in my opinion, in our approach to brain changing, two non-negotiables, and that is sleep and nutrition. There's a couple of reasons for that. So, if you think of your house, so remember, our brain is a house, our nervous system is a house. And when a brain injury occurs, I think of that as a huge thunderstorm coming in. So now you go from clear skies to dark, stormy skies. When there is a brain injury, the dark, stormy skies may linger. This can cause a lot of what's called brain inflammation or neuroinflammation. So one of the first things that we have to do, that you have to do if time hasn't done it by itself, is you have to clear the skies. You have to clear the dark, stormy skies. You've got to try to control the neuroinflammation. And two very simple ways to do that are through getting on a good sleep schedule and then also focusing on your nutrition. Not just eating what's healthy for you, but eating what's actually going to feed your brain and feed your mitochondria. The reason that these are non-negotiable is mostly because if you go into the world of mitochondrial health, when there is a brain injury, a stroke, or a concussion, the mitochondria are going to shut down. So I'm going to talk all about this in the second workshop in a couple weeks, but I think it's important to touch on now. So the first thing that has to happen before we go into brain rehabilitation is you have to clear the stormy skies. Sleep and nutrition can do that. How they can do that is through the mitochondria. And I'll tell you real quick how. So with sleep, we have in our body, we have the lymphatic system. In our nervous system, in our brain, we have what's called the glymphatic system. And in brain injury, the glymphatic system, so the system that helps clear debris from our brain, can get totally shut down. It can just get totally skewed. And the way that our lymphatic system works best is when we're in a deep sleep. So sleep will help clear the clouds if we can get on a good sleep schedule. When there's inflammation, the mitochondria are not just the powerhouse of the cell. They're not just these mindless muscles. They're also very keen on what the environment is around them. So if the mitochondria that are in the cells that are in the brain see inflammation, they will not go to work. It's what's called the cell danger response. They'll shut down. They will not go to work. They see that the environment is not hospitable to performing their best functions, so they go dormant. So when there's inflammation, it's much more difficult for the mitochondria to go to work. This is really important because it's hard to build neuroplasticity when there's inflammation. The reason for that, I truly believe, is because you're not getting the most out of your mitochondria. Some mitochondria may say, hey, this is cool. Like I can handle this bad storm. I'm going to go back to work, but it's going to burn them out. So you've got to control the inflammation. And one of the best ways you can do that is by feeding your brain proper foods, but also feeding your mitochondria. So we'll talk about that in the second workshop. But those are the two non-negotiables. The reason I say that is because in brain rehab, so we work with patients who still have feeding tubes, they're still trached, so they're not able to eat, and dietarily they're just not getting the best nutrition. Some of those tube feeds are really, really not healthy at all. They're just not. They're good at getting calories in, but they're not good at getting the best out of the cells and the best out of the mitochondria. So we have these conversations with our patients and we talk about what is actually going to help feed the brain, feed the mitochondria, feed the cells, and patients will start blending their own foods and using them for their loved ones. So it's a really important conversation to have. And it's hard, I will say that, because we do not live in a society that is set up for success when it comes to food, both financially and then also just by exposure itself. The majority of Americans don't eat real healthy food, and it's gotten pretty bad. All right, so that's going to be the next workshop in a couple of weeks, the two non-negotiables, and we'll get into more like applications once we get into the workshops. This is just laying the foundation. And speaking of foundation, a brain injury will create a crack in the foundation of the nervous system. So the foundation, right? Going back to the house. When you're building a house, if you don't have a strong foundation, when you start to put the scaffolding up, the walls up, the roof up, if your foundation is not strong, the house will not last long. So what you have to do is you have to look at the foundation and figure out where there's cracks in the foundation from the brain injury and what you need to feed it in order to either fill in the cracks or smooth out the foundation so you have a strong foundation. So step one in brain rehabilitation is reestablishing a strong neurological foundation via the brainstem. Because if you remember, the brain builds from the bottom up, the back to the front. I posted a few days ago about primitive reflexes that are basically that reemerge after a brain injury. There are some common primitive reflexes that reemerge after a brain injury. If you're not familiar with primitive reflexes, It's a set of stereotypical reflexes we're born with. They are survival reflexes. They typically disappear in the first year of life based off of environmental exposure, sound, movement, touch, all those things. They basically become what's called inhibited, and with their inhibition, you get bigger brain development. One of the areas of the brain that keeps those primitive reflexes inhibited, it's the neocortex, so like the front part of the brain. And when there is a brain injury, no matter where you get hit, you're most likely going to have corresponding issues in other places because it's a big network. And what happens in a brain injury is primitive reflexes can reemerge. So if the primitive reflexes live in the brainstem and the primitive reflexes being inhibited allows for the brain to work better, then wouldn't it make sense to go back? And that's what this paper talked about. It was a paper published in a physical therapy journal. Wouldn't it make more sense to remediate those reflexes or do sensory stimulating exercises to feed the brainstem to build the foundation so the bigger parts of the brain can develop, as opposed to just going straight to therapy for the deficit? So brain injury, can't move hand, try to make patient move hand. It would make more sense to set the nervous system up for success by stimulating the brainstem by doing primitive reflex reemerging or primitive reflex inhibiting exercises. So some of the key neurorehabilitation strategies are breath work. um, Breathing is probably one of the most overlooked things in brain injury because it's something that we mostly do unconsciously throughout the day. But your breathing can totally change in a brain injury, and you may not even notice. And the reason that that's important is because our cells need oxygen to survive. And if you're not breathing in a relaxed, diaphragmatic, very oxygenating breath, then you're not feeding your cells and setting your cells up for success. Another neurorehabilitation strategy is focusing on trigeminal nerve stimulation. So this is all going to be the third workshop, but I'm going to give you a little tips and tricks in this one. But this is all going to be like how to do it, what the research says, all that stuff in the third workshop. The trigeminal nerve is our fifth cranial nerve. It innervates our face, so it helps with it helps stimulate the muscles of mastication, which means chewing, but it also provides sensory stimulation to the face. And there's some neat research that shows that if you stimulate the trigeminal nerve, you can improve brain blood flow, which would improve oxygen and nutrition to the brain cells, which could improve nerve function, improve brain function, and improve human function. So that's the reason for trigeminal nerve stimulation. Vagus nerve, I know everyone's heard of this nerve. Um, in school, we were taught for boards it helps you poop and sleep, but it does so much more than that. It does do that. But the vagus nerve is very far reaching. It's located lower in the brainstem. And there is a lot of studies that show in a brain injury, even though you haven't directly affected the brain stem, like if it's a physical trauma to the brain and not an anoxic brain injury or an ischemic injury to the spinal cord or brain stem or anything like that, the vagus nerve can secondarily be impacted. One cool paper that I've shared before shows that within hours after a brain injury, there's gut dysfunction. They showed that within 6 hours of brain injury, it led to intestinal permeability in mice, which is also known as leaky gut. And they followed up that study by initially doing vagus nerve stimulation before inducing brain injury in mice, which I know this is horrible, but this is how they studied it. And what they found was that when there was stronger vagal function because of the vagus nerve stimulation, there was less permeability of the intestine after brain injury. They essentially had more brain resilience and body resilience due to the vagus nerve stimulation. So that was really neat, but it also shows just how important the vagus nerve is. And then lastly, primitive reflexes. I have a good example. I misspelled primitive. I have to fix that. a patient who was an elite gymnast, and she's 16, just crushing life, doing great in school, and she over rotated on one of her flips, landed on her head, had a severe concussion. Her grades started slipping. She couldn't sit in school. All the things that happen in a concussion. Of course, at the doctor's office, all the scans are normal. Give it time. It had been over 2 months. Uh, all the things. When we did our assessment, again, this was a concussion. This wasn't like a major brain injury, but it was a really bad concussion. And on my initial exam, I went straight here. So I went and looked at how good are her cranial nerves working. We ask all the questions. How are you pooping? How are you sleeping? All those things. I looked at her breathing. We did sensory exercises and testing to her face. And then I did a primitive reflex exam, which she'd never had before. And in an elite gymnast, so like this is a kid who can do a double backflip, they should have pretty good balance. I did one of the tests, and her test was just so far gone that, I knew that if we just started doing work on the brainstem, it would almost serve as a trickle effect to the rest of her brain. And it really set the stage for her to just get better and better and better. And so that's the reason that's important, the primitive reflex stuff. So, just something to think about. This is a little Instagram post I made I wanted to share with you, but hypopnea or shallow breathing. I think of it also as like rib breathing, more of like a sympathetic breath. It can be a common complication after a head injury. And with shallow breathing, you're not engaging your diaphragm, resulting in a partial filling of the lungs. This can lead to a buildup of carbon dioxide or hypercapnia, which could change the way that your brain works essentially, but also just changes your recovery. So doing focused breath can really help. And it's very simple, but it's something that you have to be conscious of because you're not used to having to take conscious control over your breathing. One of the guys we work with in the clinic, I love this kid so much. He calls it CCE, constant conscious effort. He's relearning how to walk now at this point, but it's so fatiguing for him because, again, just like breathing, at some point in your life, walking becomes something that you just don't have to think about. But for him, he has to think about every little detail of every step that he takes with his left foot. So the whole time he says CCE, constant conscious effort. And it's a good reminder for me too, because you know, I try to be very motivating in the clinic, and sometimes you forget, hey, like their patients are listening to you and they're motivated, but they're so focused on trying to move every single tiny muscle in their body to do the right movement. So it might be good to, shut up and let them do their work sometimes. So CCE, shout out to my guy, CCE. If you don't follow Dr. Andrew Huberman, Huberman Lab, on social media, I highly recommend it. He's actually a neuroplasticity researcher. Mostly I think his work at Stanford is involved with the visual cortex or vision and neuroplasticity and vision. But he's probably one of the best things that came out of the pandemic era for me because I found him on a podcast and then I just started listening to him and I love the way that he presents information, and the speakers that he has on there are great, but I just also love when he just talks. So I learned this from him, and this is something that we all naturally do. But if we're going back to CCE, constant conscious effort of breathing, you can use the physiological sigh to help stimulate your vagus nerve. So what the physiological sigh is it's almost like a reflexive breathing pattern that we have in times of stress. But again, you could use it for constant conscious effort. Long nasal inhale followed by short nasal inhale before a long slow exhale. This will help stimulate the vagus nerve and shift the nervous system away from sympathetic to parasympathetic activity. Because at the end of the day, one of the things that we're trying to do in brain injury is really shift the conversation of the nervous system. It's almost like we took a very well balanced nervous system that could say, hey, it's time to go fight or flight, or hey, it's time to go rest and digest. And now it's like you could be sitting on a couch, and even though you're sitting on a couch, your brain thinks that you're trying to run away from a cheetah. So this really does help reset the nervous system and rebalance things. And you could do it for just a minute or two, and you'll notice a change in the way that you feel. And it's a short, so I'm sorry, initially it's long nasal inhale, followed by a short one at the top, get all that carbon dioxide out, and then a long exhale. I say with a sigh, something like that. So maybe you don't want to do it in public, but when you sigh or when you make a noise or hum, the back of your throat, you're also stimulating the throat muscles, which is also engaging your vagus nerve. So that's another way to help stimulate the vagus nerve and work on breath work after a concussion. For anyone listening, what I would recommend doing is you could do something like this if you need it, like, a here and now like situation. If you're stressed out, sit down, go through a couple of these breaths, and you'll start to feel better. Or to build better vagal tone for low cost, you could start doing this consciously on a daily basis, a couple minutes each day, either morning, night, or both. There are some pretty profound potentials of vagus nerve stimulation. Vagus nerve stimulation can improve parasympathetic function, so it can help shift us away from the fight or flight and more into rest and digest. It can help increase HRV. HRV is our heart rate variability, and what the research shows is that higher heart rate variability is equal to better health. Also, higher vagal tone equals increased HRV, which is equal to better health as well. It can help improve barrier integrity. So, our system is made up with barriers. We have our skin barrier, our lung barrier, our gut barrier, and our brain barrier. What vagus nerve stimulation research has shown is that after a brain injury, if there is intestinal permeability, repetitive vagus nerve stimulation can help improve the permeability of the intestines. So if you're doing functional medicine or you're doing nutrition after a brain injury and you're not making the gains that you thought you would make or you want to make, or you're getting a little bit better, but you still have some symptoms of leaky gut, vagus nerve stimulation can help get you over the plateau. Also, too, the research shows that it can help with blood-brain barrier integrity, which is really important because typically, if there's inflammation in the brain, there'll be inflammation in the gut and vice versa. So if you need to improve barrier, and the reason you're improving barrier function is you keep all the bugs out, right? The barriers are there so the bugs stay out of the brain, the bugs stay out of the gut. You only absorb everything that you need and want, and everything else gets turned into waste. So improving blood-brain barrier function is extremely important. Integrity is extremely important. Improving GI motility. So common complaint after concussion, common complaint after brain injury or stroke is constipation. There's a couple of different reasons for that. It could be a side effect of the medication. It could be because of more of a sedentary lifestyle that you're leading now because of these injuries. But also too, it could be because that the vagus nerve isn't functioning the way that it should. I posted this one day about improving GI motility, and some lady went on a rampage just telling me how like this was all fake medicine. I don't get into any like online debates or whatever because, people, in my opinion, people know what they want to know, not really what the research shows. But this lady was like the head of an organization for Brain Injury Foundation. And I was scratching my head because I was like, I don't even know why this is something that you would want to fight about. Like, I'm just putting information out there to help people learn that when the brain is injured, the gut can be injured, and something that can help improve gut motility, which is really important because you want to get the poop out, is by doing vaguely stimulating exercises. So, anyways, again, just kind of blew my mind that someone wanted to fight me over that. But this is really important in brain injury because if you're not getting the waste products out, what can happen over time is that the undigested food particles that are going to be removed as poop can build up in the large intestines, and that can structurally change the way that your gut is working, and it can open up what's called the ileocecal valve, which is kind of like a door between your small and large intestines. And with that, you can get what's called SIBO, small intestinal bacterial overgrowth, and that can lead to a whole other host of problems. So you really do, if concussion, brain injury, stroke has led to constipation, getting on some good therapy, supplement, nutrition, anything like that to help improve GI motility is extremely important. Also, too, it can reduce stress and anxiety. Maybe that lady should have tried it. All right, so that's step one, and that will be workshop number three. That's where we'll focus on the brainstem, or if you're thinking of the brain and brain injury rehabilitation as a house, focus on the foundation. Step two, after we've worked on inflammation and brainstem stimulation, in our clinic, I focus on the balance centers. And the reason for that is I kind of equate those, if you're building a house, to the framework, to the scaffolding. Those are the cerebellum and the vestibular system. And I've never seen a concussion, a stroke, or a brain injury patient who didn't have signs of cerebellum or vestibular dysfunction because those two neuroanatomical areas are extremely important and they control a lot of different functions. So this is from a paper. The frequency of dizziness and disequilibrium following head trauma is about 40 to 60% among non-hospitalized patients. So the reason I'm presenting that to you is because it happens, right? Like, and more people than not, they get some sort of balance issue or disequilibrium sensation. Studies show, and this is from an organization called NORA. If there's anyone out there who works in optometry or ophthalmology, NORA is a great organization that focuses on basically doing eye exercises and vestibular exercises in patients who have suffered from brain injuries and strokes. Really, really great organization. I highly recommend you checking them out. Just Google NORA. I believe they have a yearly conference. They also have a doctor locator. They're a different discipline than I am, but really great providers. So, studies show that 90% of all traumatic brain injury patients suffer from visual dysfunction, such as but not limited to blurred vision, sensitivity to light, very common, reading difficulty, headaches with visual tasks, reduction or loss of visual field, and difficulty with eye movements. So go back to the kiddo I was talking about, the gymnast, right? She's sitting in class under junk light and has to read books, repeat, listen, all this stuff with all this going on, even though these are totally like you can't see them, right? It's an invisible injury essentially, a concussion is. So you can't see that the patient is injured, but that all this is happening and you're expecting the kid to just get better. It's not going to happen. You've got to help feed the brain what it needs. So with that being said, focusing on those neuroanatomical areas are really important. Interestingly enough, we talked about the foundation being the brainstem. The outpouching of the brainstem is the cerebellum. There's over 65 billion neurons in the cerebellum. It's known as the little brain. And it's not just for balance, it's not just for coordination, it also helps with higher cognitive functions. There's this concept called dysmetria of thought. So a dysmetric movement is a movement that's just not smooth, right? They don't have the coordination. So it's a lack of coordination in movement. But dysmetria of thought is a lack of coordination in thought. So after concussion, you have someone complaining like, man, I like, I work in finance or accounting and I can't like think linearly anymore, or I'm in a conversation and I can't go from A to B in my conversation. I just get totally rerouted. That's a dysmetric thought pattern, and it could all be generating from the cerebellum. So working on balance exercises, working on vestibular exercises, working on eye exercises, all that can help improve that symptom. So, and you learn that from the history of the patient, but balance exercises, vestibular exercises, those can look like a couple of different things. Different eye exercises, retraining the eyes, eye movement exercises, and then also coordination exercises. All that can help stimulate that area and it can help smooth out some of those symptoms that the patients have. How am I doing on time? Okay. Step three, assess and rehabilitate the sensory brain. So this is putting the walls on the house. We're rebuilding the brain, rebuilding the house. The sensory brain includes our auditory brain, which is the temporal lobes, our visual brain, which is the occipital lobes, and then our feeling brain, which is the parietal lobes. I'll go way into detail on all of this in the fifth workshop, okay? Even though this is step three. Wait, the fifth or fourth? Am I that far? Yeah, gosh, okay. Oops. Okay. So I've made a couple of posts about this if you follow my page, but reduced cerebral blood flow signifies one of the most lasting markers of concussion in animal models of TBI. While CBF, cerebral blood flow, has been shown to be decreased immediately after injury in animal model, and decreased regional CBF persisted after injury. So the reason that's important is if there is cerebral blood flow changes, we're going to get nutrition and oxygen changes to the brain. A lot of times this does happen in the sensory areas of the brain. So the temporal lobe, the parietal lobe, the visual lobe or occipital lobe. And one of the ways that we work on this is by trying to improve blood flow to areas of the nervous system. One of the easiest, most non-invasive methods that you can use is some sort of red light therapy. The reason for that is what the literature shows is that red light therapy or photobiomodulation, that's like the key word they're using now in their research, has several important potentials for optimizing brain function. It can increase nerve growth factors and brain-derived neurotropic factors. It can help increase synaptogenesis, so it can help improve synaptic, basically new synapses forming. It can help improve new blood pathways forming, angiogenesis. It has a potent anti-inflammatory effect. So it can help improve blood flow, improve oxygen, improve nutrition, improve nerve cell communication, all while reducing inflammation. Remember, going back to nutrition and sleep, the mitochondria are keen environmental sensors, and they will not work if there's bad storms that are still going through the brain. So using the red light therapy can help mitigate the storm and improve mitochondrial function because of the anti-inflammatory effects. It can help reduce cellular death, apoptosis, and neuronal excitotoxicity, which, I think is at the root. I have a couple patients who they're healing from their brain injury very slowly, and they'll go months and months and months without a seizure, and then all of a sudden something will just set them off and they'll have a seizure. So anything we can do to help reduce neuron excitotoxicity would be beneficial for the healing brain. Now, the reason I'm showing the light therapy in this section is because when I do the fifth workshop on this, I'll be talking about how we do what's called co-activation in the clinic. So if a patient's performing a sensory task, let's say, for example, if you see my page, we have someone who had a middle cerebral artery stroke, which can affect a lot of the sensory brain. A lot of what's covered in that artery shed area is the parietal lobe. So a patient who has trouble feeling their body will do sensory exercises on the affected arm or leg while we are simultaneously using light therapy on the receiving neurological tissue of that sensory exercise. So for example, if you close your eyes and you're with a friend and you ask them to draw a capital letter in your hand, you should be able to receive that information in your brain and see the letter in your head, even if they draw it upside down. If you can't do that, it could be a problem with that area, and that often happens in a stroke or a brain injury. So what we'll do is we'll try to remap the brain by doing that exercise while we're simultaneously feeding the cells what they need, certain depths, penetrations, wavelengths of light that will help increase nerve growth factor, synaptogenesis, angiogenesis, reduce the inflammation, all while they're doing the exercise. So we're co-stimulating, co-activating that area. That's why I wanted to show you the red light therapy in that section. On top of that, we'll also do auditory stimulation. There's lots of different ways to do this. We'll use a video game software in our clinic called NeuroSage. We'll use different types of frequencies, songs, sounds, anything in different ears to affect different sides of the brain. We'll use visual stimulation, vibration stimulation. Vibration's awesome for the healing brain. Electrical stimulation, and then also the laser therapy or red light therapy. All right, last but not least, step four. The this is going to be probably the biggest workshop I do, I think, just because as I get older, I'm 40 now, I realize just how important the roof of our brain is. So, in a brain injury, part of the brain that can be injured are the frontal lobes and the prefrontal cortex. The prefrontal cortex is the area of the brain that makes you who you are as a person. So if you just don't feel like yourself after a brain injury, this area most likely has been affected. But the good news is there's a lot you can do to help stimulate and rehabilitate and create neuroplasticity in this area of the brain to help build a better you. I'm big on this. I've posted about it probably a million times. I do it for myself. There's no substitute for physical exercise, which is part of the reason why I think just standard therapy works so well. Because a lot of times, a patient who's had a brain injury, and if they've never done exercise before, they're now doing all these exercises. So they're starting to move their body more, feel better, and it's all for very similar reasons to the red light therapy. You can increase the nerve growth factors, increase synaptic genesis, increase angiogenesis, reduce inflammation, and also, which is really important, you can shut down secondary injury damage. So you can attenuate secondary injury damage, which is really important after a brain injury. You can kind of like set the stage for continued brain healing when you do physical exercise. And there's lots of reasons for that. Physical exercise engages not only the prefrontal cortex, but so many other areas of the brain. There's sometimes a social aspect to physical exercise. There's just so many reasons that it works, and we'll talk all about that in the fifth workshop. But some of the key neurorehabilitation strategies for the front part of the brain include mindfulness training, physical exercise, something called expressive writing, if you've never looked into it. I learned about this from Dr. David Hanscom, who wrote a book called Back in Control. He's a retired spinal surgeon who, long story short, he put himself out of business because he found when he started to do expressive writing for himself and then have his patients do it, that their pain, despite physical abnormalities in the spine, their pain levels and their pain levels were reduced and their physical function got better by doing expressive writing. It's really neat. It's a really, really neat practice. TCDS, which is just electrical brain stimulation, and of course, we use red light therapy on the brain as well. So some of the key takeaways, conscious controlled breathing, the CCE, conscious controlled effort or continuous conscious effort, is really important. You've got to try to reestablish deep belly breaths and shift yourself out of that sympathetic fight or flight ribcage breathing. Rest and sleep are important, not necessarily isolating yourself, but just getting, doing some sleep hygiene exercises, which we'll talk about in the next workshop, to help improve your sleep will really, really help for multiple reasons. Just with that being said, you don't want to isolate yourself because that's old methodology with concussion and brain injury. I'm still so blown away that that's also still something that's recommended. Like, don't do this, don't do this, just sit in a dark room and calm down. I'm like, all right, yeah, like that could work for a very small percentage, but most people like their brain needs the stimulation. Nutrition creates optimal internal environment, so it helps reduce the inflammation, and it really helps set the stage for building neuroplasticity. And sleep, nutrition, and brainstem stimulation build back our barriers. That's why I start there. I think that's one of the most important areas is to start. I think it really helps optimize the potential for neuroplasticity, and that's why we are dedicating a whole workshop to it. So this is a really good website, xhalr.com. It's a free website and it can help you take back conscious control of your breathing. I really like it because if you go to the website, you can actually like type in different patterns of breathing that you want to focus on, and you can do that. But it's basically a guided breathing exercise. So, for people who are constantly in a stressful state, even if they're just stressed out, this could really help them. And it's a free website, so I highly recommend checking it out. This is a great book. If you've never heard of Kevin, he is a 2011 brain injury survivor. Long story short, I always say that. I think my dad used to always say that. Or my dad always says that. He he was in New York and he had a really bad fall, like a fall from high up. I think he was like climbing a water tower and he suffered a DAI, a diffuse axonal brain injury, and he took control of his nutrition after his brain injury. He had a severe brain injury, and now he's writing books. He also puts together meal plans and he helps guide patients on how to get their nutrition back. So this was a really good book. It's a few years old. I'm not sure if he's updated it recently, but you can follow him on social media, How to Feed a Brain or Feed a Brain, and his name is Kevin Ballister. So I just wanted to add that in there and share that with you guys if you've never heard of him. These are two other really good books. So I forget when this came out. I think it was like 2018. It was before red light therapy was as popular as it is now, which is one of the reasons why I like it so much. But Ari Whitten, he wrote both of these. This is his newest book. I think this was like 2022 or 2023 or maybe 24. I can't remember. I read this one. I read this one. I've had this one for a while. Um, and I believe he's also doing an update to this book because it was written 7 years ago. But this book provides a lot of references on red light therapy, the importance of red light therapy, and it talks, about all different health conditions and how it can help, and lots of evidence-based to research articles in there to back it. And same with this. I really enjoyed this book. I think he does his homework. Like this guy knows his stuff very, very well. He also has a podcast called the Energy Blueprint Podcast. So highly recommend checking that out. And if you just type him into Instagram, you'll see his pages. But this book is fantastic for understanding why eating what you're eating is going to help feed your mitochondria, feed your brain, and help improve health and well-being. So lots of other good books out there, but those are my three for brain injury. Okay, so in the next workshop, we'll go into sleep and nutrition for brain injury. That's the one that I've revamped in the past year, mostly because things have changed for me just the more I learn. So we'll do that in a couple weeks. I'll have a date set on social media for you. And these are always recorded, so if you can't make it. But for more information, if our clinic, we work with patients from all over, so feel free to reach out to us via email. Jasmine runs our front desk. I could always do like a 20-minute free call with you if you're ever interested, or if you know someone that could use our help. And then we work with a device company that has like the lasers and stuff like that. So if you're ever interested, that's their information. And then my Instagram page is right here.